Everyone, and thank you so much for being here tonight. I know there's a million other things you could be doing on your Thursday night, so I appreciate that you're here, and the fact that you are here tells me one thing, and that is that you deeply care about your child or someone in your life with ADHD. If this is your first Wired for Wonder session, welcome. My name is Samantha Jones, and I am a special education teacher here in Blacksburg. I'm an ADHD coach in training and someone who also has ADHD myself. And this entire session has really been a passion project of mine because I truly believe that understanding really does change everything. So tonight we're going to be talking about one of the questions that I probably get asked more than any other, and that is, I think my child, oh, I didn't have that up, sorry. And that is, I think my child might have ADHD, now what? So maybe you've been wondering, if you're just coming in, if you'll just sign in and grab a clipboard and a freebie. So again, maybe you've been wondering if what you're seeing is just typical behavior for your child's age. And maybe a teacher has shared some concerns, or maybe homework has become a nightly battle, or mornings feel like complete chaos. Or maybe you're scrolling the internet or asking friends, reading articles, on Facebook groups, and now you have more questions than answers. So if that's you, then you have come to the right place. So my goal tonight isn't to convince anyone that their child has ADHD. I am not a doctor. I cannot diagnose your child, so please don't ask me to. But my goal is to help you understand the process. And I sort of want to pull back the curtain and show what happens when families begin asking these questions, because I know firsthand how overwhelming this journey can feel. All right, so by the end of tonight, my hope is that you'll leave feeling a little bit less overwhelmed, more informed, and more confident about what your next step might be. So let's get started. So I think this picture perfectly captures what so many families experience. You know, you start noticing little things like your child can't seem to get out the door in the morning, or homework that should take 20 minutes takes 2 hours, and they're constantly losing things, or maybe they're melting down after school. So you start looking for answers. You Google, you ask friends, you join Facebook groups, and one person's going to tell you to call the pediatrician, and someone else is going to say you need to see a psychologist, and someone tells you need to request a 504, and someone else says you need to get an IEP. And then someone else says ADHD is overdiagnosed and it's made up. And someone else says girls don't have ADHD the same way boys do. And before long, you're standing in the middle of this maze and you're wondering, where do I even begin? So if you've ever felt that way, you're not alone. So tonight we're going to walk this maze together, sort of one step at a time. All right, so this is kind of what tonight is and what it isn't. So before we dive in, I just want to set a few expectations. Tonight is about information, it's about guidance, it's about understanding the process, and it's about empowering you to advocate for your child. What tonight isn't, I cannot diagnose your child. I cannot tell whether or not your child qualifies for an IEP or a 504, and I certainly give medical advice. Every child is different and every family is different, but my hope is simply that you'll leave here understanding the process better than when you walked in. So I'd like you to meet two children. So both of these kids have ADHD, both were evaluated, both received the exact same medical diagnosis. One has an IEP, one has a 504, and one kid in the same situation might not have either. So how is this possible? Don't answer, just hold on to that question. Because by the end of tonight, you're going to understand exactly why two children can have the same diagnosis, but completely different educational plans. Sorry, there's something in my eyeball. So tonight's journey, this is where we're headed tonight. We're going to start with those first clues that made you begin wondering to begin with. And we'll talk about what an ADHD medical evaluation actually looks like. We'll discuss why ADHD is sometimes difficult to recognize. We'll talk about what happens after a diagnosis and how to begin building your child's toolbox. And then we're going to spend a lot of our time talking about school supports, because that's where so many families have questions. We'll cover great teaching, the laws that protect students with disabilities, the difference between a 504 and an IEP plan, how schools determine eligibility, what happens if your child isn't eligible, the evaluation process here in Montgomery County, what special education actually looks like, how accommodations are chosen, public versus private schools, and finally, how to become your child's best advocate. All right, so this is one of my favorite slides of this presentation. And throughout the entire summer series, we've talked about becoming detectives. And we've said, you don't want to be a firefighter, you want to be a detective, because firefighters go in and they just put out fires. But the difference is detectives, they look for clues, they gather evidence, they look for patterns. And every investigation starts with clues. And I want you to notice something. None of these clues say ADHD. They aren't DSM criteria, they aren't a diagnosis. They're simply the observations that parents begin collecting long before they ever schedule an appointment. So parents don't usually come to me and say, I think my child meets the diagnostic criteria for ADHD. They say things like, homework is taking 3 hours every night, or why do I have to remind them 10 times to brush their teeth? Or they're so incredibly smart, why are they struggling? Or why can they focus on the things that they love, but not the things that they have to do? Does that sound familiar? And these are conversations that are happening around kitchen tables every single day. And what I want you to remember is that a clue is not a conclusion. And one clue by itself doesn't tell us very much. But when we start to put all of these clues together, the picture begins to emerge. And that's exactly what a quality ADHD evaluation is supposed to do. We're not trying to prove that it's ADHD, it's trying to understand the whole child. It asks, what patterns are we seeing? Are these behaviors happening in more than one setting? Could something else be explaining what we're seeing? Again, good detectives stay curious. They don't jump to conclusions, they gather evidence first. So once you started noticing the clues, where do you actually begin? All right, so this is probably the easiest part of tonight. What's the very first step? So if you're wondering whether or not your child might have ADHD, I almost always recommend starting with your pediatrician. And they already know your child's medical history, they know your family, and they can listen to your concerns, ask questions, and help determine what the next step might be. But for many children, the pediatrician can complete the ADHD evaluation on their own. But for others, they might recommend a psychologist, a developmental pediatrician, a psychiatrist, a neurologist, or another specialist, depending on your child's individual needs. And again, many times kids have comorbidities that can, make the process a little different, like autism. They might want to send you to an autism specialist, and things like that. So one thing I do want to prepare families for is that wait times to get in with certain specialists can vary quite a bit. Some have wait lists and they can, see you fairly quickly in a week or two, and others have wait lists that are months or even years to get in. So that's why I encourage families not to wait until things become overwhelming before making that first phone call. Even if you're still unsure, like starting the conversation doesn't commit you to anything. You can always cancel it, but I strongly recommend you go ahead, make a phone call, get on a wait list, and just simply get the process started, even if you change your mind. I've also included a QR code in your handout with local providers and community resources, because those options and wait times do change over time. And again, I'm not endorsing any of these medical providers. These are just after surveying some around the community. These are a list of some ones that other people recommended and that do provide those evaluations. But again, I don't specifically endorse any of them. So remember, you don't have to know exactly which specialist your child needs today. Your job right now is just to simply begin the conversation. So what happens when you've made the appointment and then you're actually going to go through the ADHD evaluation? So what happens during this process? One of the biggest misconceptions about ADHD is that there's one test that tells you whether someone has it or not. And I so wish it were that simple. But unfortunately, there's no blood test, there's no, brain scan. I mean, there are brain scans, but it's not used every day for a diagnosis. There's no magic ADHD machine. Instead, the evaluator does exactly what I've taught you guys to do. They become a detective and they begin gathering clues from lots of different places. They'll spend time talking with you because nobody knows your child better than you do. And they'll gather information from teachers through questionnaires such as the Vanderbilt, because ADHD has to be present across multiple settings for your child to be diagnosed with it. It cannot just be at home. So they'll spend a lot of time getting to know your child, and they'll ask you questions about attention, their behavior, executive functioning, emotions, development, school performance, grades, daily routines, and just as importantly, they're asking another question, which is, could something else explain what we're seeing? Because again, we've talked about comorbidities and ADHD. We've talked about other things that can mimic the symptoms of ADHD. Anxiety can sometimes look like ADHD. Learning disabilities can sometimes look like ADHD. Sleep disorders we talked about in the first session. Trauma and medical conditions can sometimes affect attention too. And so again, a good evaluation isn't trying to prove ADHD, it's just trying to understand the whole child and figure out where these behaviors are coming from. And one thing I think it's helpful for parents to know is that ADHD isn't diagnosed because a child checks one or two boxes. There's a very specific diagnostic criteria that has to be met. So there's this big list of symptoms that I'm not going to show you, but you can look them up. But the symptoms have to be developmentally inappropriate and persistent. They have to have been present for at least 6 months. And several of the symptoms need to have been present before the age of 12. And they need to occur, like I said before, in more than one setting, such as both home and school. Because again, ADHD is a neurodevelopmental disorder, not something that only happens in one environment. So if we are getting symptoms in just one environment, a lot of times there's a problem with the environment, not with the child. So those symptoms have to be causing meaningful impairment in the child's daily life. So it has to be a significant impact, whether it's academically, socially, or in other areas of functioning. And there's another reason why a quality evaluation gathers information from multiple people in multiple settings. The goal isn't to ask, does this child forget their homework sometimes? Well, every kid sometimes forgets their homework. The goal is to determine whether there's a consistent pattern that meets this diagnostic criteria for ADHD. And just like any good detective, they're gathering evidence before they reach a conclusion. So if ADHD has specific diagnostic criteria, then why isn't it always easy to recognize? So if you've attended my earlier sessions, you've heard me say over and over again that there isn't just one ADHD. If you've met one person with ADHD, you've met one person with ADHD. It's very different in everyone. And that's the biggest reason why many times the diagnosis isn't straightforward. So for many years, the ADHD research focused on young boys specifically, who are obviously hyperactive. And unfortunately, that testing process hasn't changed much since the 1980s. Even though we have so much more research on ADHD, unfortunately, the evaluation process has not really kept up with the research. And so that became like the picture many people had in their minds. And again, but we know that ADHD doesn't always look like that. Some children are predominantly inattentive. Some are hyperactive or impulsive. Some have a combination of both. And we know that girls oftentimes will present differently than boys. A lot of times children are incredibly bright and they use their intelligence to compensate for years before anyone realizes how hard that they're working just to be at the same level as everyone else. And again, some children even spend all day holding everything in at school and they're really good at masking. And then the minute they get home, they just completely fall apart. And again, many children have other conditions that co-occur alongside ADHD, or again, can look very similar. So oftentimes, because those symptoms overlap so much, it's hard to tell, well, is this coming from ADHD? Is this coming from a comorbidity? Is this something else entirely? And again, you're not looking for a label. You're just trying to understand your child's brain. You want to understand their strengths, their challenges, and what supports they truly need. All right, so let's imagine that your child completes that evaluation and they do receive an ADHD diagnosis. Then what happens? So many people think that receiving a diagnosis is the finish line, but in reality, this is really your starting point. A diagnosis gives you information, it gives you understanding, and it helps you explain why your child is struggling. And once you understand what's getting in the way, then again, you can begin to put those supports in place. Like we talked about before, you can utilize your toolbox. We can find the bottleneck of the behaviors and which executive function is being impacted. But again, this is where the real work begins. And a diagnosis doesn't tell you exactly what to do. It just simply opens the door to possibilities. So again, think of ADHD diagnosis like someone handing you a toolbox. So there is no one size fits all treatment for ADHD. I wish there was. It would make my job and my life a whole lot easier. But again, a diagnosis doesn't hand you a solution, but it does hand you a toolbox full of possibilities. So medication might be one tool, parent education, school supports, healthy routine, sleep, nutrition, exercise, technology, therapy when appropriate. All these things, executive function supports, even relationships. Every child has a different toolbox. And no child or most children don't need every single tool in the toolbox. And our job isn't to collect as many tools as possible. Our job is to figure out which combination of tools helps our child to thrive. So one of the tools that parents ask me about more than any other is medication. And so before we spend more time talking about school supports, I just want to take a few minutes to talk about that. So when should I consider medication? Again, full disclosure, I am not a doctor. I'm not a neuroscientist. I'm not a psychologist. I cannot diagnose your kid, but I can give you information. So a lot of times parents ask me, how do I know when it's time to consider medication? And first, I want to say this is an incredibly personal decision, and there's no right or wrong decision. But it is a decision that should always be made between your family and your child's medical provider. And my role tonight isn't to tell you whether you should or should not choose medication. Again, I'm not a doctor and I cannot give you medical advice. But my role is to help you think about the question differently. We ask, should my child take medication? But actually, I think the better question is ADHD significantly interfering with my child's ability to learn, build relationships, and enjoy everyday life? Because that's really what we're going to treat. We're not treating the diagnosis, we're treating the impact it's having on a child's life. So take a look at this graphic. Is your child struggling to demonstrate what they know at school? Is homework taking hours every single night? Are friendships becoming difficult? Is your child constantly frustrated or beginning to believe they're lazy or stupid? Is family life revolving around constant reminders, conflict, or overwhelm? So again, if ADHD is significantly interfering with one or more of these areas, it is worth having a conversation with your child's pediatrician. And one thing that sometimes surprises families is that medication is not considered a last resort for school-age children with ADHD. Based on current medical guidelines, medication is actually considered a first-line treatment for many children with ADHD because it has been studied more than almost any other treatment that we have. And I want to be very clear about what first-line treatment actually means. It does not mean that medication is the right choice for every child. It does not mean that every child with ADHD needs medication. And it certainly does not mean that medication is the only answer. It simply means that based on decades of research, medication is one of the most effective treatments we have for reducing the core symptoms of ADHD. As a matter of fact, it is one of the most effective medications that we have, period, on the market for anything. It's one of the highest producing most highly effective drugs for what it is intended to do. But again, remember our toolbox. Medication is just one tool. It's not the whole toolbox. And I also want to address something that I hear from parents all the time. I hear things like, I don't want my child to become dependent on medication, or I don't want medication to change who they are. And these are completely understandable concerns. And they are, again, very important conversations to have with your child's medical provider. But I also encourage families to think about something else. we spend a lot of time talking about the possible side effects of medication, but we don't always talk about the consequences of untreated ADHD. Not necessarily unmedicated, but untreated in general. So ADHD can be treated in many ways. Research has shown that untreated ADHD is associated with higher rates of academic struggles, school discipline, depression and anxiety, relationship difficulties, lower self-esteem, employment and financial challenges, motor vehicle accidents, substance misuse, and involvement with the criminal justice system. Now, that does not mean that every child with ADHD will experience those outcomes. I am not a criminal, so here, if that makes you guys feel better. But it reminds us that ADHD isn't simply about just being fidgety or forgetting your homework. When significant ADHD goes unrecognized and unsupported, again, supported can mean a lot of different things. It can very much affect areas of a person's life. But the good news is that these outcomes are not inevitable. We have so many effective treatments and incredible teachers and wonderful supportive families like all of you guys, and accommodations, behavioral strategies, and medication when it's appropriate. And again, we know so much more about ADHD today than we did 20 years ago. And that's why you're here tonight. You're learning how to build the right toolbox before those barriers become bigger. And one final thing I think it's important to remember is medication does not teach executive functioning skills. It doesn't replace good parenting, it doesn't replace great teaching, and it doesn't replace good routines or healthy habits. What it can do for many children is reduce some of the barriers that ADHD creates so that they're better able to learn, practice skills, build confidence, and benefit from all of those other supports. But again, at the end of the day, the goal isn't medication. The goal is not to avoid medication. The goal is just helping your child to thrive, and that's going to look different for everybody. And again, everybody's toolbox is going to look a little bit different. And even if your child does get medication, you still have to teach them those executive functioning skills and support them in other ways too. So let's open another important section of the toolbox. And this is going to be our school support toolbox. So this is one of the biggest misconceptions that parents have. Sometimes families think if my child doesn't qualify for a 504 and IEP, well, the school can't do anything to help. And that's simply not true. Great teachers make adjustments for students every single day. I've got some great teachers in the audience here that I know make wonderful adjustments for all their students, not just their ones with IEPs. It's our job to give kids what they need. And at least the teachers at Margaret Beeks, I can vouch for, are doing a great job of that. But they're going to be using visual supports or chunking assignments or provide movement opportunities. They check in frequently. They use flexible seating. They provide small group instruction choices. They're building great relationships. And again, these are just simply good teaching practices, and they help all learners, not just kids with ADHD. So in fact, many students receive these kinds of support long before anyone ever talks about a formal support plan. And sometimes those classroom supports are enough, but sometimes they aren't. And when they're not, families often begin hearing words like 504 and IEP. And before we talk about those two support plans, I think it's important to understand why they exist in the first place. So these aren't just school policies. These are actually federal laws that were created to protect students with disabilities and ensure that they have access to an appropriate education. So I don't expect anyone to leave tonight remembering all of these acronyms, but I simply want you to know that these protections exist. So first we have IDEA, which is the Individuals with Disabilities Education Act. And this is the law that governs special education. So if a student qualifies under IDEA, that's when they can receive an IEP or an individualized educational plan. IDEA guarantees eligible students a free and appropriate education, often called FAPE, in the least restrictive environment, or the LRE. So a least restrictive environment varies from child to child, but the majority of the time in Montgomery County especially, that is going to be in the general education classroom with their peers. But not always, because again, it's our job to give kids what they need. But always especially in Montgomery County, our goal is to have them in the general education classroom as much as possible with their peers. So it's also going to provide access to specially designed instruction and all those related services like speech therapy, occupational therapy, physical therapy, and things like that when they're needed for those children. So next is Section 504 of the Rehabilitation Act. So unlike IDEA, Section 504 is a civil rights law, and its purpose is to make sure that students with disabilities have equal access to learning. So students with a 504 plan don't receive specially designed instruction. So instead, they receive accommodations that remove barriers to learning. Those can be things like movement breaks, preferential seating, check-ins, visual schedules, noise canceling headphones, things like that. So these people are not, or these students are just, maybe they don't need specially designed instruction from a special education teacher. Maybe they just need an accommodation to be able to access the general ed curriculum, with everyone else. And even kids with like allergies, or say they're in a wheelchair or something else, they would all qualify under Section 504. And then finally, we have the Americans with Disabilities Act, or ADA. And this is another civil rights law that kind of extends beyond just schools. And it protects individuals with disabilities from discrimination in school, in college, the workplace, public spaces throughout their lives. And really the biggest takeaway from this slide is that these supports aren't something that schools just offer because they're being nice. If a student is found eligible, these protections are legal rights established through federal law. So as a special education teacher, by law, if your child receives these supports, I have to give it to them. If it is written in their IEP, I have to provide it to them by law. It is a legally binding document. And if not, they'll throw me in IEP jail, and I don't want to go there. So, but again, the purpose of these laws is not to give kids an advantage. The purpose is just to remove barriers so that every child has the opportunity to learn and participate and be successful. And I really like the quote at the bottom because I think it sort of captures the heart of all three laws. And it says, support isn't about fairness, it's about access. And equity doesn't mean giving every child the same thing. It means giving each child what they need to be successful. And I get this all the time, as a special education teacher. It's like, well, so-and-so gets this, I want that, or why can't I have that? I'm like, well, that's what their brain needs to be successful. Your brain doesn't need that to be successful. Everybody needs different things. Just like I need glasses to see, but maybe you don't need glasses to see. Does that mean it's not fair? No, it just gives me access to be able to see, right? So again, now that we understand why these protections exist, let's talk about the two types of school support plans that parents hear about the most. And this is probably one of the most confusing parts of the whole process. And people throw around the words like 504 IEP as if people just automatically know what they mean. And I'm bad about it too, because it's just an everyday part of my language, but let's simplify it. So again, a 504 plan provides accommodations, and it changes how a student accesses learning. Again, maybe they need the movement breaks or teacher check-ins, a visual schedule, noise canceling headphones, reduced distractions, things like that. Just accommodations to help remove the barriers. But again, they're not getting specially designed instruction from a special education teacher. An IEP, on the other hand, does provide that specially designed instruction. And that means we're not just changing the environment, we're actually changing how instruction is delivered because the student needs specialized teaching to make progress. And the easiest way to kind of remember it is a 504 changes how a student accesses learning, and an IEP can change how a student is taught. Both are individualized, both are legally protected, and both can be incredibly helpful, but they're just simply different tools. And so naturally, the next question becomes, how does the school decide what a child needs? And again, this brings us back to the beginning where we have those two children, and they both have the same diagnosis, but they have different educational plans. And so often I hear that a child has to have an official ADHD diagnosis from a doctor before the school can evaluate them. And that actually is not true. If there is a suspicion that a disability may be impacting a student's education, parents or school staff can request an educational evaluation. Now, having a medical diagnosis can absolutely be helpful, and it does provide valuable information to the team to help better understand the child. But again, it's not required for the school to begin the evaluation process. And here's why. So again, the medical system and the educational system have two different jobs. So medical providers diagnose ADHD, and schools conduct educational evaluations to determine whether a student meets this eligibility criteria for services under IDEA or 504. Our school psychologists also play a critical role in that process. They work alongside teachers, special educators, families, and other specialists to gather information through observations, assessments, rating scales, academic data, interviews, classroom performance, and parent input. And the team looks at the whole child before making any educational decisions. And again, it's not the team's job to simply ask, is this child struggling? It's our job to ask, why is this child struggling? And before determining that a disability is creating an educational need, the team has to consider whether something else could better explain the student's difficulties. It's the same thing as the doctor, where they want to make sure that ADHD is causing the behaviors and it's not something else. And we have to do the same thing. So, we have to look at things like, has the child had significant attendance issues? If they've missed 60 days of school, in the first, 6 months of school, then that's going to be something we're going to consider. Because then we're going to say, oh, is this as a result of a disability, or is this because the child wasn't in school? Have they had inconsistent educational opportunities or frequent school changes? If your kid has been to 4 different schools in the last 2 years, that's something we're going to look at and we're going to consider. Have they received appropriate instruction? Did they have access to quality schooling? Are they an English language learner? Is there another factor that better explains what we're seeing? And again, this is why educational evaluations are so comprehensive. The team is going to look at all of the available information and determine whether the student's educational challenges are primarily the result of a disability and not something else. And as educators, we may document that a student demonstrates significant inattention or impulsivity or hyperactivity, executive functioning difficulties, or other characteristics that are impacting learning. We can say, we can list these symptoms that might be related to ADHD, but I can't come out and say, I think your child has ADHD. Our role, and again, these are commonly associated behaviors with ADHD, but I can't make a medical diagnosis, and nobody in the school can, not even our school psychologists. Our role is to determine whether there is evidence of a disability that is creating an educational need, and whether that student requires accommodations and or specially designed instruction to be successful at school. And I didn't say this before, but you also, within an IEP, your child also has access to accommodations too. 504 plan is just accommodations, IEP is usually both. But again, that's why a child does not need a medical diagnosis before they can become evaluated at school. And again, that medical diagnosis can certainly provide us with valuable information, but it doesn't automatically determine what services a student will receive. So you can come to me and say, my child was diagnosed with autism or ADHD or dyslexia or anything else, and that does not automatically mean that your child is going to qualify for services. So I just want to reiterate that. I get that all the time. It's like, well, my child has this diagnosis from the doctor. I'm like, well, I have to determine people have disabilities all the time, but it does not impact their ability to access the general education curriculum. And, and if it doesn't, well, then we would maybe determine that they don't need that specialized instruction or supports. So again, the doctor's asking, does this child have ADHD? And the school is determining that educational need and what supports they might need to be successful. And we have to determine that an actual disability is causing the problem. And so that's exactly why 2 different children with the same diagnosis can walk away with 2 completely different educational plans. And, but one thing I want to talk about next that we don't often talk about is What happens if my child is not eligible? Sometimes a child can go through the evaluation process at school and they don't qualify for an IEP or 504. And for families, this can feel really discouraging. But a child not qualifying for services does not mean that their struggles are not real. So please hear me when I say that. And it certainly does not mean that there is nothing that you can do to help. And remember our toolbox. Again, those school services are just one tool. Great teaching is still available. Home strategies still matter. Executive functioning skills can still be taught. And you can still continue working with your child's pediatrician or specialist. And if your child's needs change over time, you can always request another evaluation. Like a not eligible decision is not the end of the story. And it's simply just information that's going to guide your next step. And if you disagree with the team's decision, you do have rights. You can ask questions. You can request that the team explain how they reached their decision. You can provide additional information. And if you still disagree, you have the right to dispute resolution options or pursue dispute resolution options, including requesting mediation or a due process hearing. And again, the goal has never been to get an IEP. The goal has just been to understand your child and to help them thrive. And so let's look at what the school evaluation process actually looks like. So again, this is everything we're going to talk about right here is specific to Virginia and specifically Montgomery County. So if you are from Radford or some other places, it might vary slightly, but these timelines are a Virginia law. So that part would be the same. So let's say you talk to your pediatrician, you gathered information, you're wondering, if your child might need that additional support at school. So what does that process look like? So the first thing I want you to know is that you, as parents, absolutely have the right to request an educational evaluation. Even if it doesn't initially come from a staff member or a teacher, if you feel like there's something more going on at school, you can request to have an evaluation done. Even though I will say our teachers in Montgomery County are really great at looking at kids and working with them and requesting evaluations for them as well. So again, I always recommend that you put that request in writing. An email will do just fine, but you need to put that request in writing. And that creates documentation and it helps everyone stay on the same page. So here in Virginia, once that referral is received by the school has 10 business days to hold what is called a referral meeting. And at that meeting, the team is going to review all the information that we have already on your child. And that could be teacher observations, their classroom performance, standardized testing scores, or interventions that have already been tried. Because the majority of the time, again, we have really good teachers here in this county. And if they notice that a child's struggling, they don't wait until there's, this formal need to do something about it. They don't just let kids struggle for no reason. They're always intervening and trying to give kids what they need, even if it's not formally documented. Also, we would look at medical information if that's something you choose to share. But very importantly, we look at your concerns as a parent. And the team decides at that meeting whether there is enough evidence to suspect, we don't have to know right then, but to suspect that a disability may be impacting your child's education and whether a comprehensive evaluation is warranted. So from there, there's one of three things that usually happens. The team may decide that there is enough information to begin an evaluation, and we would go ahead and start that process. They might decide that they need additional interventions or more information before they move forward. They might say that they don't have enough evidence to determine that, or not enough evidence to suspect a disability. They might need a little bit more. Or they may decide that they may determine, that an evaluation isn't appropriate at that time. And so if the team decides to move forward, they will ask for your written consent. We cannot do anything without the consent of a parent. If we decide that we want to test your child for A, B, and C, and then I have this happen quite often where we'll have a suspicion that it might be one thing. We start the testing process, and then I'm like, actually, based on the numbers and the things I'm getting back, I think it might be this, or I might want to look at speech, or I might want to look at this other thing. I can't just, even though you consented to have the evaluation, if you did not consent to those specific tests, I cannot evaluate your child in that area without your consent again. So I would have to call you up and say, hey, can I get your signature? And is it okay if I do a deeper dive and do some different testing? So once you sign your consent, that's when everything is going to officially begin. So here in Virginia, schools generally have 65 business days. These are not calendar days, these are business days from the referral to complete the evaluation and determine eligibility. Here in Montgomery County, we try to keep it at 55 days, and we try to do this as quickly as possible. If your child is found eligible for special education services, then the IEP team has 30 calendar days to develop the initial IEP. And again, these timelines are specific to Virginia. So if you are from another state and you're joining online, I know I have some people from out of state who are joining. These are going to be different, but overall, the process is typically very similar in other states. But again, this is a process. There are timelines, and you are a part of this every step of the way. And you do have rights. And it is important that you know that you have a voice and that you are an advocate for your child. And also going into this, when I say advocate, and it's like you have to fight every step of the way. But again, we have really good teachers here, and the goal is always collaboration. So always go in with that collaboration mindset. Like we're all on the same team, and that's your child. So you don't have to go in like ready for a fight. Most of the time it is, we're all on the same team, and we're all going to work together to make sure that your kid gets what they need to thrive. But you should never feel like you're walking through this process alone. And I do want you to understand your rights, just in case. But let's say your child is found eligible. So what does special education actually look like? I think this is one of the biggest fears that people have. They hear the word special education and they often picture what schools looked like 30 years ago, or even back when I was in high school. Special education was in like this random room in the dungeon and of the basement of the school, and you never saw those kids. And, it's very different. And I do want to say, and again, I'm biased, I work here in Montgomery County, but Montgomery County does do a really fabulous job of promoting inclusion and inclusive classrooms. And again, 9 times out of 10, your child is not leaving their classmates all day. Our division has a strong philosophy of inclusion, and that means many students receive their services right inside of the general education classroom through co-teaching. So what that looks like is there will be a general education teacher and a special education teacher, and they collaboratively work together to teach the whole class. So not every class or not every student in that class is going to be a special education student. We're going to have students, average students in there as well. So again, I'm going to teach all the students in the class, not just the special education students. And sort of the whole idea behind this is that you should never really know which kids are special education students and which ones aren't. So we're going to work through small groups, and I'm going to teach everybody, and they're going to be divided up into groups. And that doesn't just mean, oh, I'm only going to teach the SPED kids, or only the SPED kids are going to be in a small group setting. No, we're going to mix them up. It's going to be inclusive. And ultimately, if you walked into a room, you wouldn't be able to tell which students are special ed students and which ones are not. And Montgomery County does do a really nice job of this compared to a lot of other surrounding counties that in this area. But now, does that mean that every student will stay in the classroom all day? No, some students will get reading intervention. And that doesn't necessarily mean they're a special education student. They might receive math intervention or speech therapy or occupational therapy, physical therapy, all, even counseling, behavior support. And again, every child's schedule looks a little bit different because every child's needs are different. And again, that's not just special education students, that's all students. We have students across the board that get different services and they're not on anybody's caseload, But these services are always determined individually based on student need. And I want to emphasize this. Special education is not a place. It is a service. If you hear nothing else tonight, please hear that. It is not a place, it is a service. And services follow students, not the other way around. So let's talk about kind of what that support might actually look like. So with the 504 and with an IEP, we talked about accommodations. And parents often ask me, what accommodations can my child get? But that's kind of the wrong questions. Like, a better question is, what barriers are keeping my child from learning? And remember what we talked about in our last session, we identify the executive functioning bottleneck first, and then we choose the tool that addresses that barrier. So if a child struggles with working memory, they might need written directions or visual checklists or copies of notes. If they struggle with time blindness, they might need timers or chunking or frequent checkpoints. Or if they struggle with emotional regulation, movement breaks might be helpful, a calm down space, scheduled regulation breaks. And again, the goal isn't to collect accommodations, the goal is to remove barriers. Here's an example. So one of the most common accommodations people recommend for people with ADHD is extended time on tests and assignments. But if you remember, what did we talk about with people with ADHD? Oftentimes they have time blindness, right? Or they frequently procrastinate, or they struggle with task initiation. And so some people, that extended time might be what they need, but not always. And I feel like it's one of those that we're kind of making it worse on that student by giving them more time, because it just gives them more opportunity to procrastinate. So a lot of times that can make it harder. So again, it's our job to make sure that we're looking at that bottleneck, figuring out which executive function is being impacted, and choosing the right accommodation for that student, and knowing that it's not just a one size fits all. And also knowing that just because it's available doesn't necessarily mean your child needs it. And sometimes giving a child an accommodation that they don't need makes them become dependent on something sometimes that they, don't really need to. But again, for a student like that, a better accommodation might be just breaking that large assignment into chunks and with frequent check-ins to help them get started. So again, it's like, that's their kryptonite. Don't give them more time. But again, the accommodations should always match the barrier, not just the diagnosis. So the diagnosis tells us what, and the executive functioning bottleneck tells us how to help. All right, so again, this is another question I get asked all the time. Should I send my child to public school, private school, or homeschool? And the truth is, there is no right answer. Every child is different, every family is different, and every school is different. And every public school and private school are different. And again, each option has strengths and each come with things to consider. So let's start with public schools. And obviously this is going to be the one I know the most about because I'm a public school teacher. But public schools, again, are required by federal law to identify, evaluate, and provide services for students who qualify under IDEA in Section 504. So that means students may receive accommodations, especially design instruction, related services, and access to a team of professionals depending on their individual need. But for private school, for some children, a private school can be a wonderful fit. Maybe they just need a smaller class size or different teaching philosophies or a close-knit environment. And those are absolutely things that can benefit some students with ADHD. But it is very important to know that private schools do operate under different legal requirements than public schools. So unlike public schools, private schools are generally not required to provide the same services or protections under IDEA. Some private schools do offer excellent support for students with learning differences, while others may have very limited resources. So if you are considering a private school, I do encourage you to ask lots of questions. Do they have experience supporting students with ADHD? What accommodations are available? Do they have a special education staff? What happens if my child's needs increase over time? Again, there isn't one answer that fits every school. And finally, there's homeschooling. For some families, homeschooling offers flexibility, individualized instruction, and the opportunity to build learning around a child's strengths. But for other families, it simply isn't practical. Or if you're like me, my daughter thinks I don't know anything and I could never homeschool her, even though I'm a teacher at her school. So again, there's no one, I know she does me dirty all the time, but there's no one right choice. And again, the goal isn't necessarily to find like the best school. It's just to find the best environment where your child can learn, grow, and be successful. And again, that looks different for everybody. But I encourage families to look less at the name that's on the building and more about what the environment is like and how is that going to match their child's needs. If you are looking at private school, I would encourage you again to become a detective. Don't assume every school offers the same supports. I would ask questions like, are your teachers licensed? Do you have staff with training in ADHD and learning disabilities? What happens if my child begins to struggle? How do you communicate with families? What training do teachers have related to learning differences? Again, every school is different, and I'm not saying that these teachers don't have those things, but they are not required by law to have those things like public schools are. So if you go to a public school, you know that the people you're going to be working with are licensed. They have certain criteria that has to be met, or we can't work in a public school. But private schools, again, where they're privately owned, their teachers don't have to be licensed. They don't have to have certain training many times. And a lot of them just, again, they can be wonderful teachers, but maybe they just don't have specialized training for kids with disabilities. So it's just good to ask before going in. And we have wonderful private schools around here too, and even some that we work with as public schools too. But again, you're not interviewing for a school, you're just interviewing for the best fit for your child. So as we wrap up tonight, I want to leave you with what I think is the most important message of this entire presentation. And that is that you are the expert on your child. Teachers know education and doctors know medicine, school psychologists know assessment, and therapists know their specialties, but you know your child. Your observations matter, your concerns matter, your questions matter. And advocacy doesn't mean walking into every meeting ready to fight. Some of the best advocates I've ever worked with aren't the loudest people in the room. They're the ones that ask thoughtful questions, they share information, and they stay curious, and they work collaboratively with the team. And so again, everybody's goal at the table should be the same, and it's helping your child succeed. And don't ever be afraid to ask questions, or if there's something you don't understand. This is very complicated language, and sometimes going into these meetings can feel very overwhelming, and you might not understand the language that's being used. And again, sometimes as special education teachers, we throw around acronyms and stuff because they're a second language to us, but we forget sometimes that not everybody knows what those things mean. So don't be afraid to ask if there's something that you don't understand. Don't be afraid to request data. Or ask why, and never feel like you're bothering people by advocating for your child, because that's exactly what your child needs you to do. And I kind of want to end where we began. And remember those two children that we met at the beginning of tonight that both had ADHD. They both received the same diagnosis, but one had an IEP and one had a 504. And hopefully now you understand why, because the schools aren't asking, does this child have ADHD? They're asking, is this disability creating an educational need? And what supports does that child need to be successful? And those are two very different questions. And again, throughout this entire series, we've talked about being detectives. And tonight wasn't about chasing a diagnosis, and it wasn't about chasing an IEP or a 504. It's just about understanding your child. And when we understand what's getting in the way, we can build the right toolbox. And when we have the right toolbox, then children don't just survive, they can thrive. And that's always been the goal. So, again, the goal was never a diagnosis. And again, ADHD is never about fixing children, it's about understanding them. So we've got about 5 minutes left, but I hope tonight helped you or help to make this process feel a little less overwhelming. Again, it's a lot of information that I try to simplify and cram into a small amount of time. If you haven't already, please take a moment and scan this QR code and complete the survey. Your feedback has really shaped every session in this series, and it helps me continue creating resources that families in our community actually need. I also added in this one what future sessions you might be interested in, and this kind of gives me an idea if there's anything else you would like to know about in the future. And again, if you have any questions, I'm here to chat. And again, just thank you all so much for being here and for caring so deeply about your children, and just for allowing me to be a small part of your journey. And I hope you all have a wonderful evening. And make sure you take, if you came in late, if you take the handout on there, you'll have access to all of your parental rights, like the legal jargon. If you print it out, it's like this thick. So it's really boring, but it does give you all the information that you would need legally. Again, local providers that are do ADHD evaluations. And then again, always my book recommendations and just sort of your starting place. So take that with you. So thank you guys.